This Week in Richmond is made possible in part by Dignity Memorial, caring for our communities with a network of funeral homes and cemeteries in Virginia and throughout North America. More information about Dignity Memorial's providers is online at dignitymemorial.com. The Virginia Chamber of Commerce, the voice of the Virginia business community, working in legislative, regulatory, and political arenas to promote the free enterprise system. Information at vhchamber.com. Virginia hospitals and health systems provide jobs. They support our economy and promote public health. Local hospitals are always open to help people with unexpected health needs. Having a stable healthcare network is vital. Virginia hospitals are our lifeline.
It's amazing what my students with special needs can accomplish. Their pride is priceless. That's why I teach.
Brought to you by the Virginia Education Association, because a good education is good for everybody.
Additional support is provided by these sponsors. And by the members of Virginia's public television stations. Thank you.
Welcome to This Week in Richmond, and a very special welcome to two experts who can talk to us about health care in the Commonwealth and in the nation. Toni Ardabell, who's the CEO of the Secours health system here in the Commonwealth. We appreciate your being on. And to make sure I get your name right, Abraham Segres?
Correct.
Okay. The Virginia Hospital and Healthcare Association Vice President for Quality and Patient Safety.
Yes, good to be here.
As you were explaining before we started the show, that most of your work is out with hospitals in the Commonwealth and working with them. And so we appreciate your being here. Hospital Week is national, and thanks to the efforts of Senator John Watkins back in 2015 and a resolution that the General Assembly approved. It's a state-recognized week too. And during this week, we want to hear more about the state of healthcare in the Commonwealth, what's happening in hospitals, what's happening with patients, and what couldn't have two better people here to tell us about it. So would you start us, and then
Sure.
Abraham, you join in and talk about this particular week and its emphasis.
Hospital Week is a wonderful time to recognize something like 11% of the working individuals in the state.
11%?
11%
Wow.
that work for healthcare. It's obviously through these folks that the citizens of Virginia are getting the wonderful care that they're getting. And Abraham will have an opportunity to tell you more about some of the quality initiatives we're doing to assure that Virginians get top quality care. I would say hospitals have about an $8.5 billion payroll in Virginia, and we spend another $18 billion in goods and services in Virginia. So we're very important to the economy of Virginia, and especially in rural counties where, if I believe the statistic is correct, healthcare providers are the top employer in something like 80% of our rural counties. So you can see how important they are to the rural counties in Virginia. There's a lot changing in healthcare right now, and it's a little confusing. People are always saying to me, what do you think is going to happen? And truthfully, if I knew that, I'd be consulting and making a lot more money. But the truth of the matter is, we implemented the Accountable Care Act 7 years ago. That's really not a lot of time for the type of changes that has made in healthcare, both in our payment system, in our quality initiatives, and in the type of work that we're doing now across the whole continuum of care. In many ways, that helped us, in my opinion, improve quality and do much more focus on quality Therefore, positions like Abraham's got created, where we're now focusing on quality at the Hospital Association and not just legislative issues. Also, though, now at the national level, we have a lot of talk going on about changing the Accountable Care Act. What has been proposed so far would be harmful, especially for hospitals and citizens of Virginia, because they're talking about block grants. Block grants in states that have expanded Medicaid is a very good thing, because you will get more money than you would have 3 years ago. For states like Virginia, where we did not expand Medicaid, block grants would be a bad thing. We would actually be the 47th lowest state in the country as far as our reimbursement would go under the block grant system.
47th lowest?
47th lowest. And so we are not in favor at all of block grants. Can the Accountable Care Act be fine-tuned and tweaked? Always. I mean, it can always be fine-tuned and tweaked. I'm not suggesting there should be no changes to it, but I will say that block grants would not be good for the state of Virginia. And I'm going to turn it over to Abraham, who can talk about some of our quality initiatives.
Abraham.
Well, thank you for having us.
Yes.
As we've known for decades, hospitals have been cornerstones of their communities and provided really good care and service to the communities they serve. About 20 years ago, however, there was a recognition through a federal report that to err is human, and that even in healthcare, sometimes people get injured and things don't go the way they should. And so the healthcare industry across the country and here in Virginia really initiate a concerted effort to look at the services they provide to the community, recognizing that for the most part things go well, but we need to make sure that things go well all the time. And so hospitals around the Commonwealth have been working within their walls to look at the quality of care they provide, how do they engage patients and families, and improve that care. And then 6 or 7 years ago, the association decided that while individual hospitals are improving individually, if we pull the hospitals together, we could really accelerate the rate of improvement. So we all read articles about healthcare-acquired infection. Many of us know a family member who's had a fall in a hospital. How do we prevent those things? And so Virginia hospitals have been working together for the past 7 or 8 years to really look at ways in which patients sometimes have less than ideal experiences, but how can we as individual hospitals, hospitals collectively, and hospitals working with patients and families try to prevent whenever possible those less than ideal situations from occurring.
I would like to add to that hospitals are no longer just interested in what goes on in their own walls. Hospitals now are very interested in community health, primary care, and keeping patients out of the hospital, which seems a little bit like a catch-22. Our goal is to keep people healthier, and through that we work with other organizations around nutrition, around childhood education, around access to hospitals or a primary care physician. Is it on a bus route? Can we help people get to their appointments? Can people afford their medications? Is there some way we can help with medications? Bon Secours in particular, the only Catholic healthcare system in the state, we have a mission that's very specific to serving those that are poor and vulnerable, as do many other non-for-profit hospitals, but ours is stated that way. And so we truly reach out to do everything we can to help keep patients happy. That's a different focus than 20 years ago in hospitals. I use the word happy. I'd like to say well, happy and well.
Right. And I don't know how recent this is, but some of us take advantage of mobile, I won't say clinics, but testing sites to get some annual or semi-annual tests made that are available and parked in a grocery store lot or a pharmacy lot, of parked somewhere in the greater Richmond area. And
yes.
I would imagine, is this happening in other parts of the Commonwealth too, where there would be mobile units from hospitals that are out providing tests?
Yes, of course, it varies across the Commonwealth, but I think many hospitals have recognized that there's an opportunity to take the service to the community.
Right.
And when you look at some of the more urban areas where simply access into a parking deck and parking garage can be really challenging, what are the opportunities to, one, decrease congestion on the main campus, while making the services more accessible to the community and the places that they live. So yes, we're seeing those mobile services being provided in communities throughout the Commonwealth.
Yeah, and that's relatively new, I would think, whether the last decade or how long it is. But
For some of the mobile vans you're talking about, I'd say it's really probably been the last decade. For some of the mobile vans that are specific to reaching out into low-income areas, that's probably been close to 20 years in Richmond.
Right. Yeah.
It's interesting you were talking about the mobile vans because I was coming out of Kroger on Saturday and I saw a mobile van. It did happen to be a Bon Secours van, so I'm happy about that, but it could have been any van.
Sure.
And the patient coming out was laughing with the nurses on the inside, saying what wonderful mojo those nurses had.
Right.
And so I was very happy to see that happen. But yes, I think going to where the community goes is what's important about healthcare. And the other big change in healthcare in today's world is how you can see your doctor. You can see your doctor via telemedicine now. You can get your iPad out. You can sign up for whatever. There's many different types of services, but you can have a visit with a doctor on your iPad. Now, that doesn't work if you're having chest pain, but it might work if you have a fever and you think you have the flu. And so people want to access their physicians in different ways than they used to.
In some way, does that help keep costs down?
It does.
Healthcare, because I mean, cost of everything rises.
Right.
And if you could do more of that, if we as those who are seeking the healthcare assistance, that.
Well, what happens is physicians can work from home when they do these mobile visits, or if they're in their offices and they're not busy, they can agree to mobile visits that day. And so that helps decrease overhead costs dramatically. For the service that we offer, it's $49 a patient, which is cheaper than if you go to your primary care office. And insurance usually pays it. Maybe there's a $5 deductible with your insurance plan, or depends on your plan. But yes, it does help manage costs, and it keeps patients out of the emergency room, which is one of the most expensive costs that you can insure in healthcare.
Go back, if you will, for a moment to the uncertainty of the future. I mean, in most businesses, what people really seek is some certainty. And thinking of healthcare as a major business, of which many of us are consumers, at some point, I guess all of us, each of us at some time, how is that uncertainty playing out in rural communities where you're talking about earlier, where maybe hospitals are having a hard time staying afloat, and in urban areas too? How are you dealing with all that uncertainty?
There is a lot of uncertainty, and we're very worried about it. In rural areas, many small independent hospitals have joined systems. That's been happening in Virginia at a dramatic rate over the last 5 or 6 years. And they joined the system for that stability. And so that's one thing that people have been doing. The other is that we're learning how to collaborate more with each other. If somebody has a best practice, we're willing to share it so that all of us can do it. In Richmond in particular, VCU, HCA, Bon Secours, we have a quarterly collaboration meeting around community health initiatives. And we're concentrating on pediatric asthma and adverse childhood events. And we feel like it helps the community as a whole and helps decrease costs both for the insurance companies, the families, to keep these kids out of emergency rooms. So we're doing things like that. And then we're putting off some decisions. We're probably not going to build bricks and mortar as quickly as we would have in the old days, because we need to understand what the future of healthcare is going to look like. So if one of our hospitals needs 30 more beds in order to keep up with their admission rate, we're saying we're going to have to wait 2 years before we make that decision, because we're not sure where healthcare is going. So there is a lot of attention too about, should we get in other fields of service? Should we do more retail? Should we, how do we branch out to protect ourselves and be sustainable so that we can provide health care in the future to the Commonwealth? And so we're looking at those initiatives as well. And you probably know about other things that are going on throughout the state, Abraham, even better than I do.
Well, I think one of the initiatives that the hospitals have been focused on for the past few years related to reducing readmissions, and recognizing that sometimes patients are readmitted perhaps due to an infection that occurred during their initial stay that required them to come in. And what we're realizing is that sometimes it's due to their inability to effectively connect with community-based services. Right. And so hospitals, I think, are being much more aggressive in identifying who can help our patients once they leave the hospital and get out into the community. And as we can engage those folks to support our patients and families, you see less return visits to the emergency department, less return readmissions to the hospital, which can be very costly. So if it's simply a matter of getting someone a ride to their doctor's appointment or getting them a prescription, that small intervention can save a significant amount in terms of overutilization of healthcare services. So we're seeing a lot of work in terms of how can we partner with others outside of the hospital to serve the patients and families more effectively, and also save total spend within the entire system.
Sure. Go back and tell me some more about Hospital Week, because in a way, it's hospital day every day. It's hospital 24/7. It's 365 days this year, 366 last year. But what are some of the unsung things, people and events? What will be highlighted throughout the nation with a national focus and here in the Commonwealth during this particular week?
We have so many unsung heroes in healthcare, our physicians, our nurses, our respiratory therapists. We have a housekeeper who has the most beautiful voice, and patients request that he come and sing to family members. That's not something that you hear about normally. And he also gives great hugs, and he's just kind and wonderful. We have nurses that help dying patients plan their daughter's wedding to have in the hospital before the patient dies, so that the mother can see her daughter as a bride. We have physicians who'll call me up and say, can I bring this little child here from such and such a place, Toni? There's no insurance. I'll do the surgery for free. Can you get anesthesia to agree? Everybody always agrees. Bring the patient. We do, what's needed. I believe that the majority of people that work in healthcare are there because it is a calling, it's a purpose. They do it because they love serving other people, and that's why I've been in healthcare as long as I've been. I'm a nurse by background, and I just love the people I work with every day because they are constantly putting other people in front of their own needs.
One of the meetings I attended earlier today actually was a collaborative we were running with community-based services that provide early intervention services for patients and families that were in the NICU. So patients are born prematurely with significant complications, and we are trying to make sure that those families get connected with the services that can support those patients, because there are often disabilities associated with those early births. And I was just blown away at how babies and families that would have not been intact 15, 20 years ago, our ability to keep those families intact was just absolutely amazing. And the commitment these families have to supporting their children, and the fact that had it not been for the dedication of our nurses and doctors in terms of intervening, there would be a family with one less child. And so it's just amazing things we sort of take for granted, but life and death occurs every day in Virginia hospitals, and it's heartwarming to be a part of that service to our community.
That 11% that you mentioned before, I've been doing the numbers, that means about 1 out of every 9 people
That's right.
in the Commonwealth connected healthcare. What about the supply of people to fill those positions as others retire, age out, or whatever? And it's bound to be a constant challenge, and also not just a challenge, an opportunity for young people, for career changers, for people coming out of the military, from people to move into healthcare. So how's it like in the Commonwealth right now in getting that 1 out of every 9 people to be involved?
It's difficult. We're in the middle of another nursing shortage nationwide and in the Commonwealth. We have asked our schools of nursing, our colleges of nursing, to increase enrollment, but they have faculty shortages. So it's hard to increase enrollment with faculty shortages. So nursing is definitely, we're very concerned about recruitment of nursing right now. The other area is we're going to have shortages of a variety of different physician specialties as well, primary care specialists. Now, nurse practitioners will be able to pick up a lot of the primary care work and do it very well. But when you have a nurse practitioner leave the bedside to become a nurse practitioner, then that, I mean, I have had 3 nurses from the same unit at a time graduate with their nurse practitioners. Well, they're ready for a more independent role, and they're
Right.
moving on.
Yes.
So we are very concerned about workforce, and talking to Virginia Nurses Association, talking to others. The state, as you may know, did a year ago increase some residency slots, allowing hospitals to increase slots up to a certain point with some reimbursement. That's always helpful to do that. So it's even if you're trying to hire housekeepers or transporters, we are competing with other jobs that are not in healthcare that would pay in the same range.
Right.
And Secours has something we call a just wage, so we pay more than a minimum wage for every job, and that probably allows us to do a little better than some hospitals in the lower paying jobs. But we are very concerned about nurses. That also increased your cost of care, because then we're hiring agency nurses, traveling nurses. Now, they're good nurses, but the cost goes up, and they don't know your hospital as well as your own staff knows your hospital. So it's an area that actually we're getting more involved in at VHHA recently, because 2 years ago we would have told you plenty of healthcare workers in Virginia. And that's how quickly it changed. And we think what happened is nurses who would have retired during the recession didn't retire. And so now lots of them are retiring, and we're in a tough place again.
In our last minute, is there something else that we should have covered on this show on healthcare? You've covered a great deal. What else would you want to add?
I would like to add that people should consider healthcare as a career. It's very fulfilling, and I'd like to tell people that are considering a second career that our second career nurses are the most successful nurses I've ever worked with. They come in dedicated with a different perspective of the world, and if you haven't thought of it and you're not totally happy with what you're doing now, think about a career in healthcare.
And they're places where they can go?
Yes.
And they get employed and then get additional education? Or?
There's a couple things. There's something called the second degree programs. So if you already have a BS in another field, you could go for 18 months to get your RN, and then you would be hired. If you need to work while you're getting your degree, we can hire you in a different role and have education.
I'm getting the signal that our time is up, so we'll leave it there. But thank you both for being on This Week in Richmond.
Well, thank you for having us.
Thanks for having us.
This Week in Richmond is made possible in part by Dignity Memorial, caring for our communities with a network of funeral homes and cemeteries in Virginia and throughout North America. More information about Dignity Memorial's providers is online at dignitymemorial.com. The Virginia Chamber of Commerce, the voice of the Virginia business community. For jobs, the economy, and public health, Virginia Hospitals, our lifeline.
The Virginia Education Association, because a good education is good for everybody.
Additional support is provided by these sponsors. And by the members of Virginia's public television stations. Thank you.